The United States is the only country on earth to have a death toll for the uninsured. You might be asking yourself, what does this mean? It means we are the only country, the only industrialized country, to not guarantee health care as a right to all of our citizens, no matter how much their income is per year, per week, per month, whatever. The proposition is we need universal health care to save lives and save money for the average American. I read about this topic a lot, maybe a little bit too much. I drive myself crazy with it. I keep up on campaigns like Justice Democrats, Medicare for All, and several others to try to keep our politicians accountable. In fact, there's a bill in the House of Representatives right now, HR 676, which would provide universal health care, or in other words, Medicare for all. And the Justice Democrats have put so much pressure on many of the Democrats to switch their positions and support this bill. And this is to save money and save lives for the average American, and to put the average American's interests before a corporation's bottom line. So today I'm going to talk about, first, the morality of this issue. Second, the economic issues that are involved with this for the average Americans, and the corporate influence that holds us back from providing universal health care. So when it comes to morality, we know from various studies, most notably a study done by Harvard that was published by the Public Journal of Health, and they found that over a period of 13 years tracking those who were privately insured and those who weren't insured, they found that 45,000 people die every single year because they're under or not insured at all. They also found that you have a 40% higher chance of having an early death because you don't have insurance. One of the main causes for this is because people don't want to go to the hospital if they can't afford it. The number one cause for bankruptcy in America is medical bills. To me, that is illogical, and I think most anyone could agree it's immoral. Some detractors say, that's all gravy, but how are we going to pay for this? It's pretty simple. The average American would save $1,851 per person if we switched over to a government-run universal health care program. The country as a whole would save $600 billion overall, or about 21.2% of the total cost of healthcare, and that's according to datadecisions.org, which is a company or a website that simply releases unbiased data and graphs and lets you decide for yourself the opinion. And those are the numbers that they came up with. There are also other sources that end up relatively in the same range. Healthcarenow.org estimated that we would save $570 billion per year, which is very close to the $600 billion mark. Now that we know this, what's getting in the way? Why haven't we already been providing health care as a right. And this one is the simplest of all that we need to take action on. It's corporate influence, money in politics. According to OpenSecrets.org, this year already $40 million, $155,621 has been spent to lobby by the health insurance companies. 717 lobbyists are working in DC in the House of Representatives and the Senate to lobby for the health insurance industry's interests and their bottom line, if we're being more realistic. And last year, the total in 2016 was $147,464,746. With 857 lobbyists, so the lobbyist mark is already up this year. So today I talked about the morality of not having universal health care, the economic issues for the average Americans for not having universal health care, and what's getting in the way. And I believe we need to put people over profits. Thank you.